Now I'll be telling you about a case study about why sterility testing is so important. So in 2012, the New England Compounding Centre, also known as NECC, produced 3 batches of contaminated methylprednisolone acetate, which is an epidural steroid injection, which was also intended to be sterile. However, due to the lapses in the sterility assurance processes, the product released and was distributed without detecting the microbial contamination present. The contaminated injections were administered to patients, resulting in a great fungal meningitis outbreak, infecting over 750 people and causing approximately 100 deaths. The root cause was identified as a failure in sterility testing and aseptic processing, sterile procedures, environmental monitoring, or sterility testing prior to patient release were not adhered to. The root cause was identified as a failure in sterility testing, and the NECC did not adhere to proper sterile compounding procedures before the release of these batches. The equipment was not adequately cleaned, and the facility failed to meet critical guidelines for aseptic environments. Several employees and the owner were jailed and had to pay very hefty fines. There are still court cases currently undergoing regarding this issue.